our lecture on the inhalation anesthetics. So we are already done with our anesthetic agents and adjuncts. We are also done with our general anesthetic agents, and those are our injectable anesthetics. So in this lecture, we are now going to discuss those agents that will maintain anesthesia, and these are the inhalant anesthetics. These are the examples of our inhalation anesthetic agents. So we'll start with our halogenated compounds, the isoflurane and the sevoflurane. So these are in bold letters, so meaning that they are the two inhalant anesthetics that we most often use in small and large animals. So isoflurane is said to be the most commonly used in veterinary medicine, and they are considered to be halogenated compounds together with sevoflurane. So there are other inhalant agents that are not used that much to maintain anesthesia. Examples of this are nitrous oxide. This is also known as the lapping gas. We also have desflurane, enflurane, halothane, methoxyflurane, and the diethyl ether. So these are the inhalant agents that are not used more often to maintain anesthesia. So the most commonly used again are the isoflurane or the sevoflurane, or they are simply also called as iso and sevo. Start with the halogenated organic compounds, and this includes the iso and the sevoflurane. So they are the most commonly used agents in this class, and of course in also in veterinary medicine. And they are liquid at room temperature, so that we need to store them in a vaporizer. So the oxygen will flows by the vaporized gas, and the gas ends up in the respiratory tract. And you have your vaporizer. The liquid is in the vaporizer. The oxygen flows by. The liquid turns into gas and ends up in the tubes, gets into the lungs, and has its effect, which is to maintain the anesthesia. So again, the vaporizer is a part of your anesthetic machine. Vaporizer is also known as the anesthetic agent delivery system or the vapor delivery system. So again, this is a device that will convert the liquid to vapor, and this is of course a part of your anesthetic machine. So it will turn the liquid anesthetic agent into a vapor or a gas, and of course it will be delivered to tubes to end up in the respiratory tract. Vaporizer is specifically defined as a device that changes the liquid anesthetic agent into its vapor and adds a controlled amount of that vapor to the fresh gas flow or the breathing system. We'll proceed to the uptake and distribution of our halogenated organic compounds, and these refer to our isoflurane and the sevoflurane. So first, the liquid anesthetic is vaporized and mixed with oxygen gas. So that is the function of our vaporizer of our anesthetic machine. Second, the mixture will be delivered to the patient via a mask or the endotracheal tube, ET tube. So almost all of the time when we are going to use a general anesthesia in animals, we're going to have a tube in them. So that is for, that of course is preferred for the maintenance anesthesia. And the third one, the mixture will now be travel to the lungs, to the alveoli, and diffuses into the bloodstream. So, of course, the mixture goes to the lungs, specifically in the alveoli. So, in the alveoli, it is where the gas transfer or the gas exchange will take place. And of course, the gas will diffuse into the bloodstream. After that, what will happen is of course, the diffusion rate now between the alveoli and the bloodstream will be dependent on the concentration gradient. So what is meant by this concentration gradient? So for example, how much of the gas or the anesthetic is in the alveoli versus how much of it is in the bloodstream or in the capillaries. Hence, if there is a bigger concentration gradient, the gas will move faster into the bloodstream. We also have the concentration gradient. So the concentration gradient is considered to be greatest during the initial induction. So during induction, there's none of the drug that is essentially present in the bloodstream or in the system. And there's a great amount of it in the alveoli. So the concentration gradient in this case is very high during induction. So thus the drug just pours into the bloodstream, which means it gets into the brain really quickly, so it actually induces an anesthesia quite quickly. The distribution of the anesthetic to tissues will be dependent on the blood supply. So of course, the blood supply is very important because it's how the tissues gets everything. So through the blood supply. So that, for example, that is how the brain will get the anesthetic and also the other parts of the body. We also have the lipid solubility. So of course, the lipid solubility will determine the entry into the tissues through the cell wall. We also have the depth of the anesthesia. This will be dependent on the partial pressure of the anesthetic in the brain. So when we say partial pressure, that refers to how much of the anesthetic now is in the brain. The more the anesthetic is in the brain, it means a deeper plane of anesthesia. We also have the maintenance of anesthesia. So the maintenance of the anesthesia will be dependent on the sufficient quantities of the anesthetic that is delivered to the lungs. So for example, if you have a patient and it is being maintained in inhalant anesthetic, for example, isoflurane, and all of a sudden the animal wakes up, of course, we wanted to make sure that the animal is still getting the inhalant anesthetic. We have to check if the vaporizer is empty, if the oxygen is off, or if there is obstruction in the endotracheal tube. Let's now proceed to the elimination of our sevoflurane and isoflurane, or halogenated organic compounds. So of course, elimination of these agents take place via the lungs. If you are going to reduce the amount of the anesthetic being delivered by the anesthetic machines, of course, this will also reduce the amount that is delivered by the alveoli, the amount of the drug that will be delivered in the alveoli. So, of course, the blood level during elimination is initially higher compared to that of the alveolar level. Of course, the drug is still in the system, and of course, the blood level of the drug is higher in the blood compared to the alveoli. Uh, the concentration gradient will now favor the anesthetic diffusion from the blood into the alveoli. So of course, this will create the concentration gradient and eventually start favoring the movement of the drug from the blood into the lungs. So there is a concentration gradient that will be formed. This is because all of a sudden there is more drug in the blood coming into the lungs or coming in the lungs. So the drug starts leaving the bloodstream. So again, these drugs are 98% being eliminated by the lungs. So they just wait for that concentration gradient such that the drug is moving now from the blood to the lungs rather than the other way around. The next is the blood level will drop quickly through the gradient as the patient will breathe out that anesthetic gas. The brain levels will drop as less anesthetic is being delivered by the blood and the patient will wake up. See the effects of the halogenated organic compounds, starting with the CNS. So there is a dose-related reversible CNS depression. There is hypothermia because most of the anesthetic drugs, of course, will cause hypothermia with some exceptions. Of course, for example, we have the hydromorphone. It causes the hyperthermia, for example, in cats. Since most of the anesthetic drugs will cause hypothermia, you always have to pay attention to the patient's temperature. For the cardiovascular system, there is depression of the cardiovascular function with fairly minimal effects on the heart rate. We also have the respiratory system, so there is dose-dependent ventilation depression. For example, if you give too much of the anesthetic gas, the animal will basically slow its breathing until such time that it will stop. It's actually a kind of protective mechanism because if you're going to give too much of the gas, that animal got to try to avoid taking an overdose through depression of the respiration. Generally, the anesthetic agents are inhalant anesthetics. Halogenated organic compounds are really safe with minimal effects on anything because they go into the lungs, they go out through the lungs, and they primarily just affect the brain for a specified period of time. Other effects of the halogenated organic compounds in the CNS are increase in the intracranial pressure in patients with head trauma or brain tumors. This drug is considered to be safe for epileptic animals. For the cardiovascular system, so these drugs will decrease the blood pressure, of course, as all other anesthetics do, with the potential exception of ketamine. So, exception yung ketamine for this because it increases the blood parameters for the cardiovascular parameters. Again, because there's a decrease in the blood pressure, this would eventually result to decreased renal blood flow. So of course, this is very important because the kidney is very sensitive to hypoxic injury. Hence, if suddenly the kidneys don't get enough blood, they potentially develop or they are susceptible to the injury like chronic renal failure. We also have the respiratory system. So these are the things that we can help the animals with. So it can cause hypoventilation, carbon dioxide retention, and respiratory acidosis. So the more carbon dioxide is retained, the animal will develop respiratory acidosis. So the animal can be helped with breathing. You have to increase the oxygen in the bloodstream and decrease the carbon dioxide. The important properties of the inhalant anesthetics that we must consider. The first is the vapor pressure. We also have the partition coefficient, the MAC, minimum alveolar concentration, and the rubber solubility. First property, we have the vapor pressure. When we say vapor pressure of the inhalant anesthetic, this refers to the tendency of the inhalation anesthetic to vaporize to its gaseous state. It also determines how readily an inhalation anesthetic will evaporate in the anesthetic machine vaporizer. So this is of course dependent on the temperature and the anesthetic machine. So the vapor pressure anesthetic agent. The vapor pressure is directly correlated with the temperature. For example, the higher the temperature, the higher would also be the vapor pressure. So the inhalation anesthetics can also be classified as either volatile or non-volatile agents. So the volatile agents, example, iso, sevo, desflurane, and halothane, have a high vapor pressure. So they are delivered from a precision vaporizer to control the concentration, delivery concentration. So for the volatile agents, they have a specific type of vaporizer that is used in them, and these are called as the precision vaporizer. So this is designed to deliver only one or only that one specific agent. So this means that if you are going to give an animal, for example, sevoflurane, we better have a sevoflurane vaporizer on our anesthetic machine. So otherwise, it will not give the right amount of gas. The same is true for isoflurane and other volatile agents. So this type of inhalation agents have precision vaporizers. So for example, you have your isoflurane. You also have to have your isoflurane vaporizer, sevoflurane vaporizer, and so on and so forth. And again, they are color coded so that we won't mix them up. So we have a specific color for isoflurane, specific color for sevo, desflurane, and halothane. This color is going to match that vaporizer. So make sure we use the right vaporizer with the right drug, and most of the time the clinics use only one type of vaporizer. For the non-volatile agents, this means that these agents have a low vapor pressure. Example of this is the methoxyflurane. So they are delivered from non-precision vaporizer. So they require, they can be delivered in a vaporizer that is not specific for that particular drug. Important property of the inhalant anesthetic agents is the partition coefficient, particularly the blood gas partition coefficient. So when we say blood gas partition coefficient, this refers to the measure of the solubility of an inhalant anesthetic in blood as compared to the air or to the alveolar gas. So this is an indication of the speed of induction and recovery for an inhalation anesthetic. When an agent has a low blood gas partition coefficient, this means that the agent is more soluble in alveolar gas than in the blood at equilibrium. So the agent in the blood is less soluble in the blood, and this agent has a faster expected induction and recovery. Of course, the opposite is true when the agent has high blood gas partition coefficient. When the agent has a high blood partition coefficient, high blood gas, this means that the agent is more soluble in blood than in the alveolar gas at equilibrium. The agent is less soluble in alveolar gas. Of course, because of this, the agent is absorbed into the blood and tissues. So the blood serves as a sponge to the absorption of the agent. So the blood is being saturated with the anesthetic agent. So because of this, the agent has a slower expected induction and also a longer recovery. Partition coefficient is important because it determines the clinical use of the anesthetic agent. For example, it is important for induction. It is also important for maintenance. So for maintenance, if we change, for example, the vaporizer setting, if we turn our vaporizer down because we wanted less gas to be delivered, how quickly will that animal respond to that change? We also have the recovery. So how long will the patient recover? Thus, the blood gas partition is quite important clinically to determine how quickly we can expect to change the plane of anesthesia and how quickly our animal is going to recover. Another very important property of the inhalant anesthetics is the MAC, or the minimum alveolar concentration. So basically, when we say MAC of the anesthetic agent, of the inhalant anesthetic, that measures the potency of the drug. And this is used to determine the average setting on the vaporizer that will produce surgical anesthesia. The MAC determines again, the dose, the potency of the inhalant anesthetic. So the lower the MAC, the more potent the anesthetic agent is, and the lower the vaporizer setting. So for example, if you only require a small concentration of the drug in the alveoli to produce general anesthesia, then our vaporizer setting is also going to be lower, because we don't need that much drug. So of course, when we already know the MAC of that particular drug, we should also try to also adjust the vaporizer setting not only according to the MAC but also according to different patient parameters. So for example, we must also adjust the MAC setting according to the age of the animal, metabolic activity, body temperature, disease, pregnancy, obesity, and other factors. And another important factor is that every patient must be monitored as individually. For the individual inhalant anesthetic agents, we'll start with halothane. Halothane is used primarily to maintain anesthesia following induction with an injectable anesthetic. So this is non-flammable. Rapid induction is induced and is degraded by UV light. It has a low blood gas partition coefficient, moderately rapid induction and recovery, and rate of change of the anesthetic depth. Halothane inhalant anesthetic agent is considered to be the most potent in increasing the CSF and the intracranial pressure. So this drug is contraindicated in patients with pre-existing intracranial lesions. It is also the most potent, sensitizing the myocardium, predisposing the heart to premature ventricular extrasystoles. Halothane has a less respiratory depression than the other inhalant anesthetics, and this is considered as the anesthetic agent of choice for patients with history of asthma. For the liver, it decreases the blood flow, hepatic dysfunction, and mild hepatic damage or This is also known as the halothane hepatitis. For the skeletal muscle, it is important to note that halothane is considered to be the most potent trigger for malignant hyperthermia. So malignant hyperthermia is most commonly reported in susceptible swine, as for example, landrace, Pietrain, and Poland China. For isoflurane, this is considered to be the most commonly used inhalant in North America. This is approved for use in dogs and horses, commonly used in other species. Of course, this is a volatile agent. It has a high vapor pressure and it needs a precision vaporizer, meaning that you need a specific vaporizer, isoflurane vaporizer for this agent. It has a low blood gas partition coefficient, so it has a rapid induction and recovery, and it is a MAC of 1.3 to 1.6, so it will of course this relates to the potency of our isoflurane, and it has a stable at room temperature, no preservatives needed. This is our isoflurane. Again, this is a volatile agent. It has a high vapor pressure. It needs a specific vaporizer or a precision vaporizer. So this is the vaporizer of our isoflurane. So this is specific, color-coded, purple cap and purple din yung ating vaporizer. The adverse effects and the effects of the isoflurane. So this agent can be used with patients with some cardiac disease because it has fewest adverse cardiovascular effects. It is not that depressive in the respiration. It maintains the cerebral blood flow. This is important to, of course, for the drug to reach the CNS. It is almost completely eliminated through the lungs, about 98%. It induces adequate to good muscle relaxation, not much that compared to diazepam. It provides little or no analgesia, and again, generally, this drug is considered to be safe. It really doesn't have some adverse effects on the patient. Sevoflurane, so again, this is another halogenated compound. It has a high vapor pressure. It is a volatile anesthetic. And of course, it needs a precision vaporizer specific for sevoflurane. It has a low blood gas partition coefficient, meaning that it has a rapid induction and recovery because it is more soluble in gas, less soluble in blood. It has a good for induction with mass or chamber. So in terms of the, again, recovery or the induction of the sevoflurane, so yung sevoflurane, it has a faster induction compared to that of sevoflurane. But in terms of the cost, so yung sevoflurane is considered to be more expensive, little more expensive compared to that of the isoflurane. Again, it has a high controllability of the depth of anesthesia, and in terms of its MAC, it has a higher MAC, so 2.34 to 2.58. So this means that if for sevoflurane vaporizer, you need to have a relatively higher setting on the vaporizer in order to maintain the general anesthesia. These are the adverse effects of sevoflurane. So minimal cardiovascular depression. It also depresses the respiratory system in terms of its elimination, of course, through the lungs, and minimal for the hepatic metabolism. And it also induces muscle relaxation. So for those animals recovering from anesthesia from sevoflurane, we may expect that they may have paddling or sometimes excitement during recovery. So for the bottom line, compared with isoflurane, the sevoflurane has a little bit faster induction and recovery. There is also a little bit faster response in the changes in the vaporizer setting. So although generally they are quite similar with isoflurane. Fluorine is not commonly used in veterinary medicine. For the purpose of discussion, it has the lowest blood gas partition coefficient, meaning that it is more soluble in gas compared to the blood. So it has a very rapid induction and recovery. It uses a special precision vaporizer because it is a volatile anesthetic, and it has a high vapor pressure. And in terms of the MAC, it has a higher MAC compared to the other agents. meaning that it is the least potent inhalant anesthetic. These are the effects and the adverse effects of our Desflurane. The ethyl ether is not that no longer used as an anesthetic agent. These are the undesirable characteristics of the diethyl ether. Halothane is not commonly used anymore as an inhalant anesthetic agent. It is being replaced by iso and sevoflurane. For the methoxyflurane, it is not also longer used, particularly in North America. For the enflurane, it is used primarily in human medicine. And for the nitrous oxide, it is also used primarily in human medicine, some veterinary use. And it is a gas at room temperature, and no vaporizer is required. Proceed to the CNS Respiratory Stimulants. So for the examples of the CNS and the respiratory stimulants, we have the doxapram. Doxapram is an analeptic agent. So when we say analeptic agent, that is a drug that will stimulate the central nervous system. It will stimulate respiration and speeds the recovery of the patient. This is used in neonates, neonate puppies and kittens after cesarean section. So this is intended to resuscitate or get the neonate or get them breathing. So for example, a dose of the drug can be placed under the tongue, just like, for example, this is similar to naloxone. If we intend, for example, to reverse opioids for naloxone. Again, this is used to revive the neonates in C-section. It can also be given IV or sublingual drops for neonates. Or the adverse effects of doxapram, so this has a wide margin of safety, lower seizure threshold for patients, and it may also cause a CNS damage. Repeat injections may be necessary, so if the initial, for example, doxapram dose doesn't work, we can give another dose of the drug, this time by under the tongue, because the drug has a wide margin of safety. So if we induce an animal and maintain, for example, it in isoflurane, and for example, isoflurane has caused the animal to hypoventilate, or when the animal stops breathing, we can give the doxapram to reverse respiratory depression from using inhalant agents or barbiturates, and to get the animal to breathe on their own again.